So there are a lot of barriers for women and children who come to Wings or to who come to any shelter. So our goal is to help them navigate through those. Some of them are educational, getting their kids into school. Some of them are in the healthcare system, accessing appropriate healthcare because they come with a myriad of difficulties that have been neglected over the years for both them and their children. There's a lot of different supports. So for example, the women, they each have a social worker. They have access to a psychologist once a week. Children have access to youth workers, daycare workers, tutors if they're having difficulties in school. A lot of referrals to outside agencies that might be able to support them in ways we can't. School-age children, we have a number of programs after school for those children. For the younger ones, they come, they have a snack, they work with the youth workers who might be doing crafts with them, who might be doing exercises and understanding their feelings, these kinds of things. The older kids, we do things with the teens in the evenings, and like Friday evenings, they might go out to launch pad or to play pool or to go bowling or to a movie. Or we have a youth room where they can game and get together. Recently got some training through the multicultural health brokers to help us and all of our staff understand different cultures and different cultural needs. We link them up with appropriate services that speak to their cultures. We are actually quite focused on that, along with our board, who have even established one of their subcommittees is strictly dealing with truth and reconciliation, so we can bring in more cultural components to the families here that appreciate those aspects of the programming. We have 2 daycares in the Wings building, and that's where moms can get some respite during the day when they're participating in programming, or if they have appointments in the afternoon. Whatever they need, we have a child care program operating here. It's not a full-time daycare, it's as needed. Our other daycare is a full-time licensed daycare called the Rocky Forest Daycare. And we take, most of our women are from here, they're from the home next door, or most of the children. We also take children who previously lived here and they've moved out and they live in the community, so that transition is good. But number one is safety. When they come here, safety is our number one value. They have to be safe from any outside interference. They have to feel that, they have food, shelter, and clothing, and they and their children are not at risk of any kind of harm. When they first come in, what is this place? What am I doing here? So calm down. They see their social worker regularly. They see the nurse practitioner who assesses what their needs are and then plugs them into the service that they need. But overall, their safety. First and foremost, they're safe here, and then they move forward from there.
When I was 7, the world within these walls was heaven. Father painted it pink with little daisies, smiles kissed us like a summer breeze.